Dear viewers, welcome to a new episode. Please click the subscribe button to encourage us to publish more medical information. What are the possible early signs of breast cancer? Any woman experience mastalgia, breast pain, with some sort degree of local tenderness usually starts to think about breast cancer. Although breast pain and tenderness could be an early warning sign for breast cancer, but there are many other causes that could be responsible for this complaint, such as hormonal fluctuations caused by menstrual cycles, using of hormonal contraception, wearing a tight bra, exposure to stress, benign breast cysts common in lactating mothers, hormonal treatments for infertility, menstrual disturbances, etc. Inflammation of the mammary glands or ducts. All of these mentioned items are initially misdiagnosed as breast cancer. Anyway, early warning signs of breast cancer could include one or more of the following. 1. Persistent lump, solid mass, in the breast tissue or in the region of armpit. This lump usually tends to be painless. 2. Swelling in the area of armpit or clavicle. It usually appears before development of breast lump, and it could be a sign that cancer has spread to the surrounding lymph nodes. 3. Breast pain and tenderness. 4. Changes in the size or contour of the breast. There are no standard criteria for the shape or contour of women's breast. Size and contour of the breast may vary from woman to another according to many factors, such as hormones, body weight, lactation, etc. Although if one breast looks different from the other one, it could be an early warning sign for breast cancer. So, regular self-check is recommended. 5. Changes in the nipple, such as retracted nipple, inward turning nipple or itchy nipple. 6. Abnormal discharge of nipple. Any type of nipple discharge, bloody, colored or even clear, requires medical attention. 7. Hypo or hyperpigmentation of the skin covering the breast tissue or the surrounding area. On the same context, it should be noted that having one or more of these signs doesn't necessarily mean having breast cancer, this because possible signs of breast cancer aren't reliable for confirmation the diagnosis. Proper diagnosis of breast cancer should include the following: physical examination. The doctor will examine the breast tissue and armpit region to search for any local lumps. Also, nipples will be examined for retraction or abnormal discharge. Checking the medical history, the doctor will ask many questions about the presenting symptoms and medications currently used as well as any menstrual or hormonal disturbances. Also, family history of breast cancer is a significant data for diagnosis. After that, the doctor will order radiological examination for confirmation of the diagnosis and to detect the extension of the spread of cancer if present. These investigations include the following: mammogram, it's the X-ray of the breast which can distinguish between benign and malignant masses of the breast. Ultrasound, it's non-invasive examination that gives detailed overlook of the breast tissue. MRI, it's ordered when the doctor suspects metastasis of breast cancer to the surrounding and deep tissues. It's usually used to detect the extent of the spread. Tissue biopsy, it's invasive procedure which includes obtaining small parts of the suspected breast tissue for histopathological examination. It's usually used in tumor staging and sometimes to determine the proper therapeutic plan. Finally, to notice any suggestive clinical signs for breast cancer, it's advised to do self-exam of the breast regularly and seeking medical advice immediately in cases of development any of these signs. In the end, do not forget to support the channel to encourage us to publish more.